Birth across cultures. Pregnancy and birth is something that is deeply rooted within our experience as a human being. How pregnancy, birth, and parenthood is participated in ranges from individual to individual, from culture to culture. What one culture deems to be normal during pregnancy, birth, and parenthood, for another it may be labelled abnormal, weird, or even wrong. Your view of normal is perceived through the lens of your values and beliefs. Differing value systems within our multicultural society shifts this spectrum of normal. Postnatally, the transition into parenthood here in Australia is often comprised of coffee dates, hikes, and that perception of getting out and about. While for some Chinese, Southeast Asian cultures, mothers enter a time of confinement called the sitting month, where the new mother remains on bed rest or confined to her residence, and there are certain things she is not supposed to do, such as drink cold drinks, squat, eat certain vegetables and fruit, stand by an open window, turn on air conditioning, or even cry. Placentas or afterbirths is the organ that provides the blood flow from mother to baby. Whilst a large proportion of Australian families send their placenta to landfill wrapped in a plastic yellow bag, there is an increasing number of new families choosing to take them home and bury them. There is also a movement that is gaining momentum of placental ingestion or encapsulation, where a placenta is consumed by the new mother in many preparations. Common is in smoothies, or the placenta is cooked, dried, and encapsulated. Placental ingestion has been linked to lower rates of postnatal depression and increased milk production. The burial of the placenta is common across many cultures. In some Hindu and Arab cultures, the placenta is considered to be alive, almost a twin sibling to the newborn baby. The placenta is cleaned, placed in a container, and buried outside of the home as part of a ceremony, almost like a funeral. How naming occurs. Sometimes names are given at a halfway point of the pregnancy, at the 20-week ultrasound when a gender can be determined, or even earlier thanks to an elective blood test here in Australia. And names are often chosen on parental preference for their sound or commonality. Generally speaking, here in Australia, there is freedom when it comes to naming your new arrival, and many take full advantage of this and let their creativity fly. This is not the practice throughout many cultures. For babies born to Swahili-speaking Kenyan tribes, their first name or birth name is chosen by an elderly relative and usually refers to the child's appearance. Hada is considered a good name for a boy who looks strong and stout. Then, up to 40 days after the baby's birth, the parents or paternal grandparents choose an adult name. Or Greek families traditionally name their new baby on the 7th day or 10th day following birth, and there is an outlined method of naming, such as the eldest boy in the family is usually named after his paternal grandfather. Similarly, the eldest girl is named after her paternal grandmother. Later born children may be given the names of other relatives. How we welcome our little ones into the world can shift and shape who they are and who they are to become. Factors such as maternal morbidity and mortality, interventions during labour and birth, and immediate access to resources can both improve and impair personal growth and development. It is dangerous to lump together everyone from one culture as the same. As nurses, it is our role to ask and facilitate cultural practices, working together.